I'm glad that you're all here this morning. I think this will be a very lively presentation, interactive, I'm promised, right, Janelle? Excellent. You just wait. All right, we'll start with the reflection this morning. This is called Climb Till Your Dreams Come True. Often your tasks will be many, and more than you think you can do. Often the road will be rugged, and the hills insurmountable too. But always remember, the hills ahead are never as steep as they seem, and the faith in your heart, start upward and climb till you reach your dream. For nothing in life that is worthy is ever too hard to achieve, if you have the courage to try it, and you have the faith to believe. For faith is a force that is greater than knowledge or power or skill, and many defeats turn to triumph if you trust in God's wisdom and will. For faith is a mover of mountains. There's nothing that God cannot do. So start out today with faith in your heart and climb till your dreams come true. I think it's interesting to note that this month marks 1 year of our Know and Go sessions. We've been doing this for a year now. So that's pretty interesting. You've come out every month and to participate, and there's obviously been some real value here for you, and we appreciate that you're back.
Good morning, all. It's, I remember when we used to get about 15 people in here, and so it's so rewarding that you take the time to come learn and listen, and it's great. I mean, when Ben Smith presented his stuff on interventional radiology, I mean, it just blew me away, the things that are going on up in their cath lab. So, great day, right? And a little bit of seasonal weather. Isn't it amazing when 3 months ago when it hit 32, you're like, oh. And this morning I drove to the Y to go spin, and it was 19, and I'm like, God, this feels pretty good. It's all relative, isn't it? All right, let's get on with our program. So, Know and Go. And in fact, I've heard much good, but you always hear bad as well. So there are some of you who don't like this, and you're like, why in the heck are we doing this Know and Go thing? And it bothers me, and I don't like it, and so on and so on. So I'm here to just kick this off, to educate a little bit on why we're doing this, and I keep hitting the audio button versus the slide. So bottom line is, many of you think that the only reason that we have Know and Go is so that Agnesian HealthCare can save money. Seriously, I know I'm not going to make you raise your hand, but I know there's many of you out there that the only reason you think that I moved this vision forward was so Agnesian HealthCare could save money. And I'm going to tell you what, that is not the truth. It's one of the things, but having a healthier workforce is the biggest and best thing that can ever happen. And I can tell you that it's not true in all cases, but it's true in the majority of cases. And Dr. Schmidt is the scientist behind this, and I'm just the amateur who does a lot of reading and has a lot of life experiences. But people that are taking care of themselves, both mentally, physically, and spiritually, have better morale. I know it. It's factual. And if you feel good about yourself because you're living a healthy lifestyle, you're going to have better morale when you come to work. And you know what? Ultimately, at the end of the day, you know why I care so darn much about this? Is because if you have good morale and you feel good about yourself, guess what you're going to do when you come to work? You're going to take care of our patients in a more effective and more complete and more satisfying way than you would have if you feel cruddy about yourself that day. Think about it. We all have those days, right? I had a cold last week, and I had the darn thing forever, and I can't kick it. And there was a couple days I showed up, and my head was about ready to explode, and I had a cough, and I was just miserable, and I wasn't as good as I am today. And it's because I feel better today. So morale is a big deal. The science is there. More productive and efficient. Why do I want that? Because we can deliver health care more effectively if we're in the right state of mind, right physical condition, et cetera, et cetera. We're more efficient, we're more effective. We're just more productive. I can tell you that right now. improve life balance. If you're doing the things to care for yourselves in the most meaningful way, you've got better balance in your life. I was at an event last night where I could have drank probably 6, 7 cocktails. And trust me, there's some of you in this room that have seen me in those states of mind, and you know that I have that capability. and Jane's laughing, by the way, because she's been to a couple parties I've been at. And I like doing that, by the way. But I didn't because I knew I wanted to get up this morning and spin at the Y at 5, and I've got better balance in my life because of that. There's one. I can tell you what, if you're living a healthy life, we're going to have less absenteeism. Okay? And that is a dollar and cents thing to this organization. Absenteeism costs this organization millions of dollars a year. And so if you're healthier and feel better about your work, excuse me, you're going to be at work more often. It's a proven fact. Fewer work-related injuries. Okay, if you're more fit, both mentally and physically, you're going to have fewer injuries at the work site. Why do I care about that? You say, oh, it's all about the dollars because you don't want those workers' comp claims and then I'll be out of work for 6 weeks. Yep, that's right. But you know what? I'm sincere in this. It's more about you being healthy and being here and being present and being able to earn your income. We're going to retain more people if we've got a healthier place. People want to come and work in places that are vibrant, that have healthy, growing, living environments where you feel good about coming to work versus, oh my God, and the lady that works next to me, and I got this, I got Dan Loos to put up with, and So we're gonna have better retention in our workplace. Yeah, I told you that. And I tell you what, we've seen that. We've seen less. Our health spend is getting better as we're getting improved operating performance. That was a little faux pas on my slide there. Other things real quick. Continued incentives for healthy living, yes. Okay, we are going to continue to incent you. And part of that is through better nutrition, spiritual well-being, and physical activity. So there's incentives for all this, and you guys are starting to feel them, and there's penalties, and we're going to continue to do that. There's weight management programs. You're keenly aware of that. There's healthy cooking classes. Dr. Schmidt's got a great thing going on, and you'll hear more about that. We're going to expand that. We're here, and it's not going away, and we're going to continue to promote health and wellness. Let me tell you a personal story. Why am I so darn passionate about this? What is it? And by the way, this Know and Go is the trademark, but ultimately, I said to our executive leadership and our board that, you know what, if we're in the business of health, how can we set the example if we're not doing it ourselves? Think about it. You show up to your physician and they say, Steve, you need to exercise more, you need to eat right, you need to quit smoking, and you need to lose weight. I mean, that's typically about the essence of it, right? And then you look at Dr. Schmidt and she smells like smoke, she's overweight, she's got a bag of Fritos open while she's sitting there checking your heart. And you're thinking, really? That's what I need to do, doctor? Seriously, and we have some like that, right, Dr. Schmidt? We have some. But think about the example. How believable is that? Or the physician that says, you need to eat right, sleep more, lose weight, but you know what? It's okay. I'll just give you this drug, and this drug will solve all your problems. Let me tell you something. Why I am so darn passionate about that is, one, we got to lead by example. If we're in health and we're promoting health, then we better be living it, right? We better be living it. Second piece is more from my upbringing. Okay? My father is 79 years old. My father can barely get from the bedroom to the dining room table to the couch. 79. Okay? And there's one reason. Himself. My dad has type 2 diabetes. He's had 2 open heart surgeries. His knees are worn out. He's had a TIA. He spends, I don't know how much on HealthCare a month, but it's a lot. Thank God I don't have to provide his health insurance. And the reason for it is all self-induced. All self-induced. I remember, this was the defining moment. We were duck hunting in Alamosa, Colorado. And my dad said, "You're going to have to set the decoys." I was 14. And I'm like, geez, my hip boots aren't high enough. He had chest waders on, big chest waders, by the way. I had hip boots on. He goes, "Well, you're just going to have to do it because I can't get out there anymore." My dad had to be around 46. And it's because he didn't take care of himself and he wasn't able to set the decoys. And I said to myself, I am never, ever, ever going to let myself get to the point where I can't set my own dang decoys. And guess what happened? I went out and I went up to past my boot. My boot was full of water. It was about 5 degrees out. And I was miserable. And that was the last time I hunted with my dad, duck hunting with my dad. And I'm not going to let that happen. And I take it personally. It's a big deal. So that's what gets me up and motivates me. We're going to continue to promote healthy living everywhere you're at. And you're going to, it's all about, I'm so sick and tired of it. You know what? We're going to do it until we get this community healthy. And I will tell you, that's part of my goal is that we shrink Agnesian HealthCare to something that's much less than what it is today. Why? Because our community is living a healthier lifestyle. And this isn't just about us, but it's about our whole community. We have, if you didn't know, we're committed to this internally because of Jane and Chrissy are here. We specifically created positions for wellness coordinators. That's what these 2 ladies do. That's all they do. And you'd say, well, that's a waste of money. Why can't, just do it on your own? No, we need the help. On a community-wide basis, we are supporting, we are paying for a absolutely wonderful young lady by the name of Kaya Schnettler. And she's housed at the YMCA, and she's responsible for promoting health and wellness within our own community, and specifically the prevention and reduction of obesity. So we're doing a lot of these things. Dr. Heather Schmidt is now spending more of her time on health and wellness issues and still practicing medicine. And so my point is we are absolutely committed to making our communities healthier. And you say, well, that's counterintuitive to what's good for Agnesian HealthCare. If we have more sick people, we're going to be more viable. If we have more people coming in here that need health services, we're going to be better off. You know what? Fiscally, Agnesian HealthCare might be better off, but our community will be worse. And so it certainly is somewhat of an unrealistic dream that Agnesian HealthCare shrinks to something less than what it is today. I hope that it happens in my lifetime. I seriously doubt that it will because human nature is human nature. But that's ultimately the goal. One of my lifelong goals is that Agnesian HealthCare is somewhat less than what it is today. Not because of that our competitors are taking advantage of us another. It's that our community is healthier. So with that, talk about spirit and health and wellness. Chrissy and Jane.
Thank you, Steve. My name's Chrissy. I am one of the wellness coordinators, also known as one of the No and Go girls. And I'm going to go over our 2013 participation results from our program. So as you recall, let's see if I can. What started our program was the health risk assessment. And in 2013, we had 3,793 people, associates and spouses, complete the health risk assessment. This picture is a picture of what would show up on your health tracker once you completed your health risk assessment. This is not actually where Agnesian is at right now. Jane is going to go over those with you in a few minutes. The next thing that was part of our program was our biometric screen. And during our biometric screen, we tested your blood pressure, height, weight, waist measurement, your total cholesterol, LDL, HDL, triglycerides, and glucose, as well as nicotine. And we put your results into the health tracker, and this is how they would show up on there. You'll notice that the green means that's a low risk, orange is a moderate risk, and red is a high risk category. So for people on the health plan, there was 89% of health plan participants who completed both the health risk assessment as well as the biometric screen. There was also other ways that you could earn points in 2013 with the wellness program. One of those ways was with workshops, and we had 1,218 health and wellness workshops that were completed. There was a variety of different challenges that associates and spouses could participate in as a fun way to engage in more healthy behaviors. And so the first one was a scavenger hunt, and that was to get you used to the health tracker, how to navigate. There was 88 people who participated in that challenge. We had a Let's Get Physical challenge where the challenge was to get 150 minutes of exercise each week, and there was 253 people who participated in that challenge. We had a Bike to Work Week challenge where it's pretty self-explanatory, either bike to work or get physically active before or after work, and there was 85 people who participated in that challenge. Jade and I also do health coaching, and so we offered one-on-one health coaching sessions where we would work with you to set a wellness goal and achieve that. And there was 184 people who participated in a health coaching session. And you can see by the number of sessions that we had that several people opted to have more than one session because there was 435 sessions that were completed. And then we know the importance of preventive care exams in early detection of disease. And so that was another way that you could earn points. And from the forms that were turned in, and it was a qualifying preventive care exam, there was 1,389 preventive care exams that were approved. So now Jane is going to go over the actual results of the biometric screens in 2013 and where we're going in 2014.
Good morning, everyone. I get to go over the numbers portion. So now if I know how to use the clicker, that is the next thing. Okay, so as we look at Agnesian results, we had a great number who participated in the biometric screens, which actually gives us a better reflection of where Agnesian is at today. As we look at these numbers, it is based on the 3,300 people that did participate in the biometric screen. If at each category, the low risk is green, the yellow is moderate, and red is high risk. So the first category that we see is our body mass index, which is a calculation based on your height and weight. And you can see from the numbers, we're at 28% low risk, 32% moderate risk, and then 40% high risk. So this is an area that obviously we want to move from the red to the yellow and increase that number in the green area. Blood pressure was another category that we screened for. We are at 48% in the low risk, 40% in the moderate risk, and then 12% high risk. And just know that for blood pressure, if either your systolic or diastolic fell into another category, that was automatically put into that next level. So for example, if your systolic blood pressure was 118, your diastolic was 85, that would automatically classify you into the moderate risk because that diastolic number fell in that range. Okay? The next one is total cholesterol. And cholesterol is a type of fat in your bloodstream, and when elevated, it can increase your risk of heart disease. There are a number of factors that go into total cholesterol, including your HDLs, which is your good cholesterol, LDLs, triglycerides, VLDLs, etc. So the total cholesterol numbers here, low risk, we are at 55%, moderate risk, 32%, and high risk at 13%. And this number, we do understand that total cholesterol, if your HDLs are higher, that will increase your total cholesterol level. So your provider may or may not be concerned with the total cholesterol based on what your actual HDL numbers are. Whoops. And the next one is our fasting glucose. And again, this is how well your body digests sugar and carbohydrates. We are at 74% low risk, 21% moderate risk, and 5% high risk. And the last one, of course, is tobacco. We did nicotine testing this year, and we have 89% of Agnesian associates and spouses tested negative, which is great. And we have 11% who tested positive for cotinine or nicotine. So as you can see, this is a good overview of each category and where Agnesian is at for each of the areas that we screen for. Of course, Chrissy and I, Janelle, our Wellness Council, Wellness Committee are committed to increasing the percentage of people that are in those green categories as we try to move and decrease those that are in the high risk and moderate risk categories. So that's obviously our goal. And 2013, we had a participation-based program. As we move into 2014, we are transitioning to an outcome-based program, which is still completing your health risk assessment, participating in health coaching, and then the majority of your points will be earned based on your outcomes of the biometric screens in the summer of 2014. And that is based on reaching that 2014 qualifying range to earn those points, okay? You probably have seen the full scorecard. This is just a snapshot of what the scorecard looks like for 2014. But you can see the full health on the health tracker, the full scorecard. So we do still encourage you to participate in the health tracker, utilizing those resources. There are a number of education topics there, like the wellness workshops. Chrissy and I are also still going to continue to offer challenges. This is just a way to help you guys engage and maintain and or improve those numbers over the next year. Also, the health tracker is where you will register for health coaching and biometric screens. Okay. And Janelle is here from the zone. She's going to get us up and moving today.
So I'm Janelle, and I would like to encourage everybody to move. I put together a special 12 days of Christmas activity that we're going to do since it is 12 days before Christmas. I thought that was very appropriate. And I'd like Steve to definitely help me out. A little of it is in his honor because he has kind of bought these gifts for us in a way. You'll see as they come. And it's really just a silly song. Don't take it seriously. I want to encourage movement in your department meetings. So, and zoners, you guys know this. I've taught a lot of you, so I expect good participation. But I want you to move more at your department meetings. Instead of coming into the room and sitting and waiting for everybody, why don't you stand? And if somebody is like the leader of your department and can champion this, use my silly song or make up a silly song, some way that you can get your department moving at the beginning of a meeting. It doesn't have to be this, but I'm trying to make it fun and something that everybody can do. If you have heels on, you may want to kick them off for this portion. And I would like the majority of you to participate. So if you want to stand up. So I'm not going to sing, so don't worry. I'm going to talk us through this. We're going to start with marching. On the 12 days of Christmas, Steve Little bought for us. On the first day of Christmas, Steve Little bought for us a partridge near a palm tree. And that's actually Danny Bonaducci with me and my husband in Jamaica. I'll explain later.
Who's Danny Bonaducci?
On the second day of Christmas, Steve Little bought for us 2 turtle doves and a partridge near a palm tree. On the third day of Christmas, Steve Little bought for us 3 French maids, ooh la la, 2 turtle doves, and a partridge near a palm tree. And there's a few things that Steve would never buy for us, but I had to throw them in. On the 4th day of Christmas, Steve Little bought for us 4 calling birds. Hello, 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 bicep curls, get it? 3 French maids, ooh la la, 2 turtle doves, and a partridge near a palm tree. This is definitely one Steve didn't get for us. On the 5th day of Christmas, Steve Little bought for us 5 onion rings, 4 calling birds, 3 French maids, ooh la la, 2 turtle doves, and a partridge near a palm tree. On the 6th day of Christmas, Steve Little bought for us 6 players checking, 5 onion rings, 4 calling birds, 3 French maids, ooh la la, 2 turtle doves, and a partridge near a palm tree. On the 7th day of Christmas, Steve Little bought for us 7 swans a-swimming, 6 players checking, 5 onion rings, 4 calling birds, 3 French maids, ooh la la, 2 turtle doves, and a partridge near a palm tree. On the 8th day of Christmas, Steve Little bought for us 8 maids a-milking, 7 swans a-swimming, 6 players checking, 5 onion rings, 4 calling birds, 3 French maids, ooh la la, 2 turtle doves, and a partridge near a palm tree. On the 9th day of Christmas, Steve Little bought for us, what's 9? 9 ladies dancing, yes. 8 maids a-milking, 7 swans a-swimming, 6 players checking, 5 onion rings, 4 calling birds, 3 French maids, 2 turtle doves, and a partridge near a palm tree. On the 10th day of Christmas, Steve Little bought for us 10 lords a-leaping, 9 ladies dancing, 8 maids a-milking, 7 swans a-swimming, 6 players checking, 5 onion rings, 4 calling birds, 3 French maids, ooh la la, 2 turtle doves, and a partridge near a palm tree. Steve didn't buy us this next one definitely either. On the 11th day of Christmas, Steve Little bought for us 11 peeps a-peeping, 10 lords a-leaping, 9 ladies dancing, 8 maids a-milking, 7 swans a-swimming, 6 players checking, 5 onion rings, 4 calling birds, 3 French maids, ooh la la, 2 turtle doves, and a partridge near a palm tree. Last one. On the 12th day of Christmas, Steve Little bought for us 12 drummers drumming, 11 peeps a-peeping, 10 lords a-leaping, 9 ladies dancing, 8 maids a-milking, 7 swans a-swimming, 6 players checking, 5 onion rings, 4 calling birds, 3 French maids, ooh la la, 2 turtle doves, and a partridge near a palm tree. Thank you. 5 minutes. So hopefully that was fun. That was my point. Just get up, move, try to incorporate that into your meetings, and thank you for your participation. Dr. Heather is now up.
All right, so I get to actually talk about fun tips to keep you healthy during the winter. So we're going to try to talk about some things. Probably a lot of it you already know, but we'll see what we can do. So this weather makes it really hard, right? So really want to just kind of hunker in, drink some hot chocolate, eat some cookies by the fire. You don't really want to do anything else. but hopefully we can find something that we can do to keep us active throughout the winter. A lot of times what happens, we get too much of our holiday cheer, so we end up snacking too much on cookies and maybe drinking too many cocktails. Oh, did he leave? And oh, there he is. And so our belts get a little tight. So I call that too much holiday cheer. So we're going to try to prevent that this year. So we're going to talk about just tips to stay healthy, because nothing ruins your holiday gatherings more than getting a bad cold or sinus infection or something. Holiday Eating Survival 101, and then hopefully some resolutions that actually you can stick to and make work for 2014. So first, so this comes from the CDC, so a lot of this seems like common sense, but it's amazing that it's not really something we always do, including me. I didn't wear my coat in today. But bundle up and keep warm. So this weather, you really need to make sure you're staying warm. Wearing multiple layers of tightly woven, loose-fitting, tightly woven clothing. So if you're outside doing any kind of activities, making sure you're dressing appropriately for that, okay? So if you're doing any kind of snowshoeing maybe, or cross-country skiing, downhill skiing, snowmobiling, which I don't really consider a sport, but you know, if you are outside doing something, people say that it's hard on them. So, but make sure you're dressing appropriately. Make sure you're dressing your children appropriately. So I don't know if you guys have kids that are like my kids, but they never want to wear their gloves, they never want to wear their hats, they never want to wear their coats, they never have them zipped up. So this weather can be actually quite dangerous for that. So make sure that you really have them try to convince them that they're going to lose a finger if they don't dress appropriately. That's what I do, which is probably not nice, but so making sure you're washing your hands. We can't stress this one enough. So especially here, working in healthcare, you're exposed to even more than you would be if you were just going to the grocery store. But wash, wash, wash. It's hard on your hands. I mean, this soap that we have here is just dreadful. But making sure that you're trying to, my hands are like always torn up. But making sure you're washing them to prevent them from from passing germs on to either yourself, because a lot of times we get sick by touching our face, touching our eyes, touching our mouth. So you want to try to avoid that. Try to keep your hands away from your face. And then also cover your cough. So everybody demonstrate to me, how is the appropriate way to cover your cough? Very good. Yes, very good. And so I don't know if we have any OR nurses or anything, but you don't really do that in the OR, right? You kind of cough straight into your mask. But so make sure you're trying to keep that covered to kind of cut down on your transmission of germs. If you're coming to work sick, that's a whole other ballgame. I'm not usually a huge big fan of that, but I know that we all do it. We all come to work when we probably shouldn't be here. But make sure you're really paying attention to your symptoms. If you have fevers, if you have something that you just are not, you can't do it, don't come, okay? And maybe your supervisors will get mad at me, but it's probably not a great idea. So we, of course, at Agnesian HealthCare, like when people come to our ER, because again, fiscally, it's very good for us. However, as a patient or as a person, we don't really want to be spending our holidays in the ER. So you want to try to prevent injuries. So make sure you're driving safely. The weather is not great in Wisconsin in the winter, but even when it's not necessarily snowing out, but the other day I was driving down and it was still really slick and it wasn't even snowy just because it's so cold. So make sure you're paying attention to the weather reports and the driving reports if you're going to be doing any traveling over the holidays. Make sure you designate a driver. If you like to have cocktails, that's completely fine, just be appropriate, but make sure you have somebody to drive you home. So don't take that chance, it's not worth it, okay? Fire safety. So right now, with all of our Christmas lights up, make sure that you pay attention to that, because it's devastating. You hear of them every year, but people's houses burning down. I think I heard of one on the news actually this morning. So make sure you're trying to pay attention to that and make sure you have it safely. You don't have 15 plugs into the same outlet. And then watch your kids, because a lot of times with holidays, we're doing our thing, we're hanging out with family and paying attention to the adults and maybe not paying attention to the kids, and they're off doing their own thing with their cousins and their friends, and they might end up getting hurt. So make sure you're paying attention to them. You don't really want somebody falling or like I've been to holiday gatherings where people are, these kids are jumping on beds and jumping off bunk beds and somebody gets a concussion. So not very fun. So it is supposedly the most wonderful time of the year, right? But stress levels actually run very high during the holiday season. They did do a survey back in 2011 that shows that 22% of people will report extreme stress levels during the holidays. So some of that is just because you've lost family members, and some of it's because of financial strains. But holidays can be kind of stressful. So make sure that you're not overdoing it. Make sure that you're setting time out for yourself. It might be 5 minutes a day that you're just doing some deep breathing. Maybe it's your exercise during the day, but some time that you have that you can kind of reflect. Make sure you have your ducks in a row and you're ready to go for the holiday season. Make sure that you actually have realistic expectations. It is absolutely impossible to be in more than one place at a time. So make sure that you say to a family member, if they're all saying, hey, I need you here, I need you here, I need you here, make sure that you say, hey, I have all these other commitments, and it's okay to say no. So if you overbook yourself, it's only going to lead to increased stress level for yourself. Remember what's important. So right now, what's important is not necessarily buying as many gifts as you possibly can. This is the holiday season. Make sure you're celebrating your family, your friends, and really remembering what the true reason of the season is, which I'm actually, just belabor throughout this. But volunteer. So if you really know that I just can't do, I need to do something. I need to spend some time helping other people during the season. Actually, it's great to do this anytime because it really does make you feel better if you're spending time doing things for other people. But volunteering, there's plenty of opportunities here at Agnesian. There's other things in the community. There's, I'm sure, church functions that you can actually volunteer with as well. But it's okay to give back, and it really will kind of just be rewarding for you as well. Seek support if you're struggling. There's plenty of support out there. We have counselors, there's clergy, there's your provider, but make sure that you have a support system. So if you know that your mother died maybe at one Christmas and every year Christmas is just impossible for you, make sure you have the support you need going into the holiday season, okay? Any questions about stress? Yeah, I think we all know about it, right? So, Holiday Eating Survival 101. So this is really a bad time. Does anybody ever make it through the holidays without gaining a single pound? Yeah, I was going to be pretty impressed, actually. I think Terry actually raised her hand. Did you raise your hand? Good for you. Yeah. Yeah, it is Terry. But start your day with a 30-minute workout. A lot of times what happens is, if you're anything like me, I'll say, hey, I'm going to do it tonight. I'm going to do it tonight. But then what happens? Tonight comes, and it doesn't necessarily happen. So starting your day is always going to be the best way to get your workout in. 30 minutes. If you don't have time to do your hour-long workout that you usually do, or even 45 minutes, or just try to get something in. So even if you don't get to do the 30 minutes, at least take the stairs, park farther away, do things like this. This is kind of fun, right? This little activity, do it with your departments. And if you're having meetings, because there's a lot of meetings, right? I've found that, actually, there's meetings to schedule meetings to schedule meetings. But make sure at the beginning of the meeting you do something. Say, okay, the first 3 minutes we're going to do a minute of jumping jacks, a minute of squats, a minute of push-ups, whatever. But at least it gets everybody in the right mind frame. So everybody's looking at me like, seriously? But remember that healthy plate. So this is something that we've talked and pushed and pushed and pushed. It's all over the place. But that USDA Healthy Plate really does help you with just kind of user-friendly ways to make sure you're getting what you're supposed to be getting in. So half of that fruit should be fruits and vegetables, right? A quarter of it whole grains, a quarter of it a lean protein. So even remember that during the holidays. Try to make sure you're really piling on the fruits and vegetables. Make sure that you're at least choosing to have some of that you're eating first. And so if you know you're going to a party and there's not necessarily going to be anything healthy there, call up, say, hey, what can I bring? I was thinking maybe I would bring some, hummus and some veggies, or maybe I was going to make a salad that has these great pomegranate seeds in it, whatever, but something that you know that you can actually eat, so that way when you go to these holiday parties, you're not offending anyone, because sometimes people get offended, but then also you have something that you can eat, so in case you have one of those cocktails, you have something in there to soak it up. Never show up hungry. Anybody go grocery shopping hungry? Yeah, it's dangerous. Yeah, so, and if, yeah. And so you end up throwing a lot of stuff into your plate, into your cart that you're not usually going to get. But same thing when you're going to a party, then what happens is you get there, you're starving, so you start piecing on anything, right? So there's all the cookies out. So of course, somehow when we entertain, we have all the sweet stuff out first, or the stuff that's not so healthy. So you fill up on that. So by the time dinner comes, you're really not that hungry, but make sure you eat anyway because you feel like you should. And so make sure you're actually paying attention to what you're doing. I heard a tip that I think is great. If you cook and you taste while you cook, get a clean spoon every time, which you should be doing anyway, but leave the spoon out so you can see just how many little tastes you had, because there might be 10 spoons laying there. And so that, if you think about that, that's probably half your meal. So make sure you're kind of paying attention to these little snacks. If you are snacking when you go through, at least put everything on a plate so you can see exactly how much of it is that you're eating, okay? If you know one of your holiday gatherings is around a mealtime, don't eat dinner and then go to the party, because that's going to just be sabotage. So make sure you just say, okay, I'm just going to have dinner there, a little snack to hold you over if it's a later dinner than you normally eat. But at least it's something that when you get there, you can have a normal size meal and not have already had a normal meal before that. Liquid calories count. So especially 6 cocktails, that would really add up. But cocktails, they have quite a bit of calories in them. Not only that, eggnog. Anybody like eggnog? Yeah. So if you're not getting the light stuff, which it sounds like, I know Janaea was trying to tell me how many calories were in there the other day, but either way, the eggnog is usually not kind of viewed as healthy. You can water it down. You can cut it with some Sprite or ginger ale or something. But definitely make sure you remember how many calories are in those drinks, because suddenly you might get an extra 1,000 or 1,500 calories just in your cocktails, okay? Coffee drinks too. I had a patient the other day that came in and he's like, well, I was doing so well and I lost all this weight, but then I got a new job, so I'm drinking more coffee. And I was like, well, coffee's not bad for you. He's like, oh, well, I'm drinking the bad kind of coffee. I'm drinking like this caramel macchiato creamer stuff. And I was like, well, that is probably not a great idea. So if you're putting all that cream in, there's extra calories in that as well. So, okay, so what if you're hosting? Do your party goers a favor. Don't serve them some big heavy meal, because nothing kills your post-dinner conversation more than everybody sleeping on the couch. So it's kind of like that at Thanksgiving, right, where everybody eats so much and then they sit down to watch football and then nobody's around to talk. So you want to make sure you're giving them something lighter. So some salads, some fruits and vegetables, some just lighter dishes, maybe smaller portion sizes. Give them smaller plates. If you give them the big cafeteria size paper plate, then they will fill it. And they will likely go back and get seconds, which then is not helping them with their portion control. So at least get a smaller plate. So if they go back for seconds, they've already cut their portions in about half. So, you can be helpful during this time too, and it can be your gift to them. And then separate the food from the fellowship. So the big push these days in architecture is an open concept. But what happens in an open concept? You have your kitchen and your living area all in one area. So then you have all the food out there, and you want all the food out there when you're all hanging out together, right? So then what do? You stand around, this is what happens at my house. You stand around the kitchen island, and everybody just keeps eating and eating and eating and eating, and nobody's paying attention to what they're doing. So it's okay to put it in a different area. It's okay that people have to get up from the table and walk for seconds. It's okay that they are not always just going to be able to kind of just shovel it in. So think about that, because the open concept, while it's nice for entertaining, it really doesn't do great for our waistline. So follow food safety tips. So a lot of times when you have holiday parties, they go all day long. So certain foods can sit out, but there's a lot of foods that can't. So if there's anything that's perishable, make sure it's not sitting out for more than 2 hours. The last thing you want to do is give them the gift of food poisoning. So they will definitely not forget your holiday party. So, but make sure that you kind of refill your platters, maybe put just enough out, and then refill them often, okay? So look out 2014. Who's good at keeping resolutions? Anybody? Yeah, good, good. So sometimes people are very good at it. So they set a new one every year, and they go with it, and they make it all year. And I had a patient the other day that said she gave up soda, and she did well. She's done it all year. But a lot of times, how long do they last? A month, yeah, a couple weeks, maybe a couple days. So it depends on what the resolution is. But let's try to come up with some good resolutions that you'll try to stick with at least, that are going to be beneficial and not overly hard to do. So some resolutions that work, veggies. So if you don't like veggies, figure out a way to like them. Figure out a way to put them in something. Maybe you put them in casseroles, or you put them in soups, or you put them in salads, or you put them in smoothies. But if you don't like vegetables, you have to figure something out, because you really need to have your fruits and veggies. So fruits are usually a little bit easier to get in people because they're sweet and kind of a natural dessert. But the veggies, sometimes people aren't really as big of a fan, my husband included. And so you have to be a little creative sometimes to get them in. But try to concentrate on it. Maybe you like broccoli and cheese, and that's the only one you like. But you like cheese with a little broccoli. So maybe every time you have it, you concentrate on just putting a little less cheese on there, so you get used to the new texture, so you get used to the flavor of the broccoli. And I promise you, you will probably, it's not 100%, but you will likely at least learn to appreciate it. You might not love it, but you might learn to appreciate it and the benefits that you get for it. So experiment with whole grains. There's a whole slew of different whole grains out there. A lot of them are very old. They've been around for a long time. But a lot of times we think of wheat, right? That's the only one we think of. Well, oats, that's a great whole grain. Quinoa, I know Rich is doing some fun stuff in the kitchen with some quinoa. Some brown rice, different pastas, but get the whole grain kind. Try to get maybe some millet, some barley, there's all kinds of fun stuff out there. And maybe every month you say, I'm going to pick one whole grain, I'm going to find a couple recipes, and I'm going to try it out. And maybe that's the only resolution you make, but at least you make that and you try to do something different every month. It'll be good for you, it'll be good for your cholesterol, and it'll be good for your blood sugar. So whole grains are actually very good for you and very filling. Eat less meat. Everybody always thinks that I am this proponent for vegetarianism, and I am, but I think that not everybody's going to be able to be a vegetarian, so try to eat at least a little less. So try to say, okay, every time I have a meal, I'm actually going to really try to do that quarter of my plate instead of half of my plate as the meat. And so that you say, okay, I'm going to have my chicken, but I'm going to have it in a stir fryer or in a pasta dish, or I'm going to have my steak, but I'm going to have it in a salad. Whatever it is, try to make sure you're getting a smaller portion of it, because we don't really need to eat the 16-ounce ribeye, okay? And the 24-ounce, what is that, the porterhouse or something? The big guy? Is that what it is, the porterhouse? I don't know. That is just, it's gross, yeah. So that's a lot of meat. But that's actually a lot. That's enough for what, 6 people? So making sure you're eating that 3 to 4 ounces, so the size of your palm of your hand. And men, yes, your palms are bigger than ours, so you can have a little bit more. Yeah. Tame your sweet tooth. This is a hard one because this is the holidays, and so there's lots of Christmas cookies and fudge and candy and all kinds of stuff sitting out there and waiting for you to eat it. But keep in mind that the average American eats 22 teaspoons of sugar a day. Now, if you drink soda, in one 20-ounce Pepsi, there's 17 teaspoons of sugar. So keep that in mind, that the average may be way less than what you're actually getting yourself, especially if you're a big soda drinker. So tame that sweet tooth. You can still get sweets, but you don't need to be having that much of sugar a day, because it's really hard on your teeth, especially, as well as your glucose readings, and it's hurting our stats. Ha, no, I'm just kidding. And then move a little more. So it might be that you already do exercise every day. Good for you. I am thrilled. Now, do a little better. So maybe you say, okay, I'm going to do an extra 5 minutes a day, or maybe you don't exercise at all. Maybe you say, I am just literally, right now, I can barely walk through the grocery store. So you start with that, and you stay off the scooter, and hopefully nobody's doing that. But you try to say, okay, I'm just going to, every day, I'm just going to try to move a little more. So you do some of this kind of fun stuff. You do some jumping jacks, and you're watching TV and you absolutely love the show and you know you're not going to turn it off to go exercise. So during the commercial break, you do some stretching, or you do some lunges, or you do some push-ups, but something where you're moving more than you currently are, okay? And so if you already are doing well, congratulations, I'm very proud of you, but just try to even bump it up a little bit and encourage your fellow employees and family members to do the same. Think those are some resolutions you can stick with? Yeah? I don't see too many nods. Okay, but most importantly, remember the reason for the season. I mean, we are here and we're blessed because this is a Catholic institution, so we can actually talk about this and we don't have to say holidays. But I mean, remember that Christmas really is about Jesus Christ. And so it's okay to reflect on that. And it's okay to say, hey, Santa, he's coming and we love him, but that's not the real reason for this. You don't need to run up your credit cards and go into more stress and financial strain just because of Christmas. So make sure you keep in mind that. Make sure you celebrate your friends and family. This is a very important time to spend time with your family. And so try to make sure you're carving out time to do that. And remember, you have a purpose in life. So this is kind of my big push. And I really think that you're not going to take care of yourself unless you know you have that purpose. So figure out what that purpose is and run with it. Because once you know what that is, then you know that you have a reason why you're here. And you know that you'll take care of yourself and do a better job with that and care more about it than instead of just losing weight. You're here to take care of yourself so you can fulfill that purpose. So make sure you kind of figure out what that is. Okay? Any questions? I know I did talk pretty fast, so. References, I use the CDC, and that's not really my daughter, it's just a picture, but but thank you. So thanks for coming.
That was fantastic. I think we need one more round of applause for our dancers up here. And maybe the best part of that whole thing for me was knowing that it was being recorded. Sorry, Steve. We have just a couple minutes. Are there any questions for the group, the presenters today?
So we have some very exciting, fun things happening. So we are working, Agnesian is with the Healthy Fun Act 2020 Steering Committee. And so we're trying to do some projects in the community. So that's some of the things. There's a Living Well Coalition that Kaya is in charge of over at the Y. And so there's some programs, the Bike Loop Project, has anybody heard about this? So 15.2 miles, I believe, around that they're trying to close the loop. And then also we're doing a new pilot program that hopefully we're going to kick off this spring. It's called the Fruit and Veggie RX program or Fresh 5 program. We're going to have some HealthCare providers, mostly with Agnesian, but we have to kind of include Aurora. So there's going to be a couple providers that we actually are choosing some families that may benefit from education and financial assistance to get fresh fruits and vegetables. So it's going to be we're raising money to fund this, but we're going to try to do a once weekly visit with a provider to get education. And at that visit, they'll get a prescription that's written for their family that they get $1 a day per family member to help fund this. And then they get a box of fruits and vegetables. Hopefully it's going to be donated by Festival. We're kind of in talks with them. And then the farmers market, we're going to try to do that this summer as well. And then they do that for 16 weeks. And they've done this program out east. I don't know if anybody heard about it on the news. The New York physicians were writing prescriptions for fruits and vegetables. Anybody see that tagline? But it's based on that program. But it shows that after the 16 weeks, people's habits actually change. So they do reach for those fruits and vegetables more often. So we're going to do that program here. So we're kind of in the beginning stages of that. We're also, can I talk about the remodel? Or not? Sure. Yeah. We're going to remodel the West Clinic basement so that it's going to be a wellness center and hopefully have a demonstration kitchen so that we can do cooking classes. My goal is to get area chefs in the door as well to get them hopefully thinking about their own menus at their restaurants and getting those looking a little healthier as well so we have healthier options out there. But so hopefully we can get them in and interested in the program to do some cooking classes, hopefully partnership with a provider so that there's a provider there as well that's helping to teach the class. So we have some very fun stuff that we're working on. We're hopefully going to develop some
brown bag lunch series to come around to your departments and actually talk about some different topics as well. So, and I'm working with the school district as well to try to do a pilot program for some of the kids that they're doing some universal screening procedures now. They're finding kids that are at risk, but they don't have anywhere to refer them. So we're going to start a pilot program to try to get them and their families really involved with education about physical activity, nutrition, safety, and mental health. So that's kind of what we're working on. So,
would we promote having devices? Maybe it'd be a stationary type pedaling device, or in some cases, you've seen the treadmill desks where you can walk and actually work on your computer and so on. And I've actually seen them in place. There's Quarles and Brady, which is an attorney firm. Are we planning to do any of that? The answer would be, as of today, no. Will we? Sure. Yeah. Would that be? You know, I think before, you know, I'm always like, if it promotes health and wellness, I'm like, oh, do it. And I get in trouble all the time because then there's some other ramifications because it violates some safety code, and then John Gormican yells at me, and you know, and it something, and so let us take a look at how we can give you devices or allow you to use devices at your workplace to promote better health or more physical activity. Great, it's a great question. Yes.
Get up or whatever. I don't think most people are going to do that for a couple of reasons. You know, you get into a pattern. You want to get, you know, you're into your groove, getting whatever done. Also, jumping in the jumping jack, whatever. You know, they're just subconscious about that. I guess I'm just wondering if is there some way
Sure.
to make it more of a
Sure, we can. I think that's a good suggestion for the no and go ladies. The question that for those who on the video conferencing, the question is, you know, a lot of people are stationary and sedentary in their work every day, and there are things that, you know, most people don't stand up, and some people feel ridiculous, like I did doing this exercise up here earlier. And can you give us some ideas of where we can involve some more physical activity in our workplace each day? And I think that's something that we could probably work on a bit. These two ladies are brilliant, so appreciate the suggestion.